I'm Richard Driscoll and I'm the Director of Development for the IBD Registry. So it's perfectly fine for all of the hospital staff who are involved in your treatment to know who you are as a patient when they're looking at the data. But once the data leaves the hospital to come to the IBD Registry, it's important that we safeguard your identity and make sure it's properly protected. Now, we do that by working with the Health and Social Care Information Centre, which is the official NHS body that is what's called a data safe haven. So they are entitled and able to securely know who all the patients are and to know whose data belongs to which patient. So they act for us by taking the data from the hospitals, and they then extract some of the data to make sure that it's what we call pseudonymized, so made nearly anonymous before it's sent to the IBD Registry. So to give an example, the date of birth, only the month and year of birth is sent across to the registry, and the exact postcode isn't sent across. It's what we call a higher level postcode, which relates to about 1,500 households, whereas the postcode relates to 16 households. And that means that there's almost zero chance that at the IBD registry level we could work back to identify who you specifically are as a patient. So what the Health and Social Care Information Centre do is that they remove your NHS number and they put in what we call an IBD registry number. And they maintain a safety file which keeps track of which NHS number matches which IBD registry number. So at the registry we don't know your NHS number and we couldn't know who you were within your hospital. But if necessary for some safety reason, we could ask the Health and Social Care Information Centre to get in touch with your doctors. It might be if you had a very unusual reaction to a drug, and perhaps as part of a safety research project, people wanted to be able to track back and see if they had your permission to look further at your records. So that's possible, but it's done in a very safe way. So one of the things that we're asking all patients to do is to consider giving their consent for their data to be used. And this is in line with what's happening in the health service generally, which is that you don't need to give consent for your data, your information to be used for your treatment. But if it's going to be used for another purpose, it's what's called a secondary purpose, then in general terms, you should be asked to give your written consent for that data to be used. Only in specific circumstances might there be an exemption, and then that exemption has to be given by the Secretary of State through a special committee. And the situation at the moment for the IBD Registry is that in order to help the registry get started for the next year up until the middle of 2016, the Secretary of State says that your data can be used in a safe way without your written consent. But during that time, we have to ask clinicians to actually ask you to consider giving your formal written consent. So during the course of the next year, it's likely that all patients will be asked to sign a form saying that they consent to their data being used for the registry, and we hope that patients will also give their consent to their data being used for research, because that obviously will be of long-term benefit to all patients. Obviously, the more data we can have for medical research, the more benefit it's going to be for all IBD patients. I should add, though, that if, as a patient, you decide that you don't want your data to be used, you do have the right to refuse your consent, and that won't affect your treatment in any way whatsoever.